Hello. Um, just an observation. As a mere mortal, I fail to understand how the CQC can rate the trust as requires improvement for safety, both in community, where most of the patients are, and crisis services, and then still have good overall. However, that's not my question. My question is, I understand that for the last 2 years, the government has cut funding to NSFT by 5%, and that's been across the board for other trusts as well, which works out at about £34 million, which seems a heck of a lot of money when you're going out and you're doing the reorganisation and putting lots of high-powered, highly paid jobs into each locality, when we really need frontline staff who are keeping our service users safe, so we don't have to continuously open the local press and read about deaths.
Yeah, thanks very much, Christine. Obviously, we're really proud of the CQC findings, and they demonstrate that we're in an improving trajectory. And I'm not one that's going to start arguing with CQC and their methodology here. I think it's an important waymarker and no more than that. As chair of the trust, I'm probably able to say a little bit more about money than maybe our executives, because we are in a national health system. But like you, I'm, with my board members, extremely vigilant to make sure that the efficiency savings that we have to make are not going to derail our improvement plan, and we are not going to let that happen. I'll let Caroline answer some questions around how we're recruiting more staff, how we're retaining more staff, and how we're being able to provide ever greater quality of services and bring those waiting lists down. But not on my watch am I going to allow NSFT to be denuded of resources so that we can't deliver on those improvements that are so absolutely intrinsically vital if we're going to provide the best possible services to our service users and carers. And that's a fight I'm prepared to take anywhere. Caroline.
Shall I pick up the particular... Hi, Christine. If I pick up the particular issue around frontline staff and leaders. I think, as you know, Christine, this trust has been really challenged for many, many years. And had 8 CQC inspections, and leadership has been a real challenge and a real theme of those CQC inspections, and that's only one lens. There's plenty of others. As somebody who's an experienced chief exec, I'm a nurse, and came into the trust and felt that we needed to really develop much, much stronger clinical leadership so that our clinicians were making decisions really close to patient care. So we have invested, we've restructured our organisation into localities. We haven't taken a hate me out of the clinical restructure. We're just currently in the middle of a back office corporate restructure, and we have taken significant money out of that, more of our back office services. But unashamedly, and I'm really proud now of our clinical structure, I think we do need leaders that are in localities, that are walking the services, whether it's crisis services, community services, inpatient wards, that we've got medics, nurses, allied health professionals, psychologists that are accountable for the quality of care, and that we've got really strong supervision with service users and carers right at the heart of everything we do. So thank you for that. And I would just say from a staffing perspective, it's not one or the other. We've really focused on recruiting and keeping our staff, and obviously the presentation that I gave earlier shows significant improvement of being able to recruit and retain our staff. We still have a lot more to do. Thank you.
And just to add to that, you know, we're sort of talking to you about sort of process and structure. The thing that I pick up when I go and talk to our staff, and I've been spending loads of times out and about doing that lately, is staff feel a real renewed sense of pride in working for NSFT. We're seeing more people apply for our jobs, more people more likely to stay with us, and people now really feeling that they can share with their social groups that they're working in a trust that they're now proud to talk about. And for me, that is absolutely fundamental to the change that we're seeing happen in NSFT. And I can see loads of our fantastic staff nodding to that. And it's you that's told me that. I'm just holding up a mirror and reflecting that back to you.